Welcome to Nolte Chapter 5. This is about ventricles and the cerebral spinal fluid. Ventricles of the brain. So we have two lateral ventricles, a third ventricle, and a fourth ventricle. Sometimes this trips students up because if something's named third ventricle and fourth ventricle, they're looking for first ventricle and second ventricle, and rightfully so, but that's not how this works. So there's two lateral ventricles that you can see there. Kind of looks like the ram's horns, right? So a ram's head of horns. And then the third ventricle is in the center, and then the fourth ventricle, you can see that rhomboid fossa, that kite shape again there, the fourth ventricle. And then what's going to happen is that's going to then get really small and circular, and that's going to then be the central canal that goes through the spinal cord. So cerebral spinal fluid inside this ventricular system of the brain and outside the brain, and inside the central canal of the spinal cord and surrounding the cord. So it's inside and out and nourishing the brain. And think about all of the sulci and gyri surrounding that area as well. So take a look at this picture, and there is a blank one in your lab manual, so make sure that you can label that. So what are ventricles? Let's define that. It's fluid-filled chambers that are continuous to one another. So this is a system in which it flows throughout and all the way through the cord. So it is not piece parts of one part of the brain and then the other part. So this is this continuous pump throughout the central nervous system. It's filled with cerebral spinal fluid. It's lined by ependymal cells, which are a type of neuroglial cells. Remember those hairy-looking teeth, the ciliated ependymal cells that we saw before. Paired lateral ventricles, so instead of calling it 1 and 2, we call them paired lateral ventricles. They're C-shaped. They look like those ram's horns that we saw on the slide before, and they're located deep in each hemisphere, right side of the brain, left side of the brain. And the pair is separated by a membranous septum pellucidum. So remember that word septum, we're looking for it to be separating something. Septum, separate. So this is septum pellucidum between the ventricles, the lateral ventricles. Each ventricle is connected to the third ventricle. So each of the lateral ventricles are connected to the third ventricle, which is central, via the interventricular foramen. Let's say that again, interventricular foramen. So foramen is just a hole, inter is in between, so in between the ventricles there's this hole, so we just call it the interventricular foramen. The third ventricle lies within the diencephalon. So remember the diencephalon is all things thalamus, and then retina is in there as well. Third ventricle is connected to the fourth ventricle via the cerebral aqueduct. So remember we had our superior and inferior colliculi, and then we had the tegmentum on the other side, and then that cerebral aqueduct connecting the third and the fourth ventricle. Fourth ventricle lies in the hindbrain. It's continuous with the central canal of the spinal cord. And we have 3 openings connecting the fourth ventricle to the subarachnoid space, so underneath that arachnoid space. So remember our pia, arachnoid, and dura meningeal layers. There's paired lateral apertures in the side walls, and then we have a median aperture in the roof. So paired lateral apertures in the side and a median aperture in the roof. Another picture for you here, a lateral view, so you could see the lateral ventricle of one side very well and a little bit of the other one. So there's the horns of the ventricles here. So you could see the front area, the anterior horn. So this is the front, this is the back. Okay, so here's the cerebellum, and then coming down brainstem cord. So we see an anterior horn and we see a posterior horn, and then you could see this guy here kind of always reminds me of one of those perpetual motion tools, right? The little sipping bird that keeps moving back and forth. That's the third ventricle, so it's kind of an odd shape. And then we see connecting that third ventricle to the fourth ventricle. So fourth ventricle, this is the side view here. Remember it had that kite shape when we were looking at it face on, but off to the side or lateral, we're going to see it that shape. And so connecting third to fourth ventricle is the cerebral aqueduct. And then the median aperture is right here and the lateral aperture here. Great. I like this slide because it has the side-by-side view of the picture, and that's able to explain it in a little bit different of a way. And then we can see the actual specimen. So let's take a look here. These big holes here, I'm drawing in my red marker on the cadaver picture, if you can see that. So those big holes there, that's the lateral ventricles. So picture that with cerebral spinal fluid in it. So those are kind of shrunken up because there's nothing in there, but they would have been expanded and there'd be a flow of cerebral spinal fluid in those ventricles. So noting here, look at all of the white matter. So let's look on the left side here real quick, and we can see these fibers coming up. Oops, let's do this. These purple fibers coming all the way up. Kind of an interesting viewpoint here. So now you could see where information would be coming from the cord all the way up into that white matter. So any problems with this white matter, multiple sclerosis plaques, or if a stroke were to damage any of these areas here, there would be an issue getting that information up. You can see just this white matter of highway. So we have our projection fibers, which is cerebral cortex to or from the lower areas, that area that I was just showing you. And then the commissural fibers between the hemispheres. So commissural fibers, let me use my green marker here, on this side right here, that's the corpus callosum. Kind of neat looking, right? So I'm going to erase it so you could see it again. So corpus callosum connecting right side of the brain to the left side of the brain, and is that thin white strip there. And then our association fibers, you can see, are within the hemisphere. So this guy to this guy kind of thought process here. Okay? So within the same hemisphere, just different information. And this also has some of the basal nuclei, being caudate, globus pallidus, and putamen. You could see some of those nuclei, those cell bodies there. You can see where the thalamus is. You can see the third ventricle and the pons. Just a nice viewpoint here of starting to associate where things are, and then looking at how huge that those lateral ventricles are, and the idea that those would be filled with cerebral spinal fluid. There's the lateral ventricle on a lateral view. Could be an MRI, could be a CT. It's either a blurry MRI or a good CT. So I would call it a CT. Would be my guess. I don't know. It's just a random picture that we have here. But this dark area in here, that's cerebral spinal fluid. So the dark area, okay, is cerebral spinal fluid. And then you can see the fourth ventricle here. So in between the third ventricle and the fourth ventricle, what was that again? That was the cerebral aqueduct. Very good. Okay, so here would be superior colliculus and inferior colliculus. Okay, excellent. Here, this is a pathology slide, is an ependymoma. So see the oma, O-M-A, at the back side of that tells us it's a tumor or mass of, so it's an ependymal cell tumor. Okay, so tumor or mass of ependymal cells. This is the cerebellum, and the fourth ventricle is what I wanted to show you here. And you can see that flocculonodular lobe again, posterior and anterior lobe. So fourth ventricle, and you can see the choroid plexus in here, right in here. So the scanning electron microscope or micrograph of the lining of the brains so this is the ependymal cells. We saw this in chapter 1 as part of our introduction. So those ciliary hairs, those green hairs. So kind of a neat thing to keep in mind that that's what that actually looks like. Cerebral spinal fluid. Again, it's going to give us buoyancy to our central nervous system structure, so it reduces the weight of the brain by about 97% by floating it, so it's not crushed by its own weight. It protects the central nervous system from trauma, nourishes the brain. So it's a watery solution, so it's an ultrafiltrate, if you will. So I think of it a lot like lymph, but a little bit more oomph than lymph. Lymph is more carries away debris. So interstitial fluid is the good stuff, and then the lymph is kind of what carries away our debris for us. Choroid plexus. Let's define that. It's a cluster of capillaries, so blood vessels, remember, so our artery, arteriole, capillary bed, venule, vein. Capillaries that hang from the roof of each ventricle, enclosed by pia mater, so dura, arachnoid, pia mater, and surrounding layer of ependymal cells. Cerebral spinal fluid is filtered from the plexus at a constant rate. Ependymal cells use ion pumps to control composition of CSF and help to clean or cleanse the CSF by removing waste. Cilia of the ependymal cells, the little hair-like projections that we see, help to keep the cerebral spinal fluid in motion. And a normal adult is going to replace cerebral spinal fluid about every 8 hours. Okay, so about 3 times a day or every 8 hours, we get another chance at cerebral spinal fluid. So we want to make sure that we stay hydrated and are able to keep up with the demand of a good amount of cerebral spinal fluid. Another picture there of your choroid plexus. I like this picture. It's going to give us this kind of play-by-play of, you can see at the bottom there number 1, and then it's in the middle there you can see the choroid plexus and that number 1 explaining that. So choroid plexus of each ventricle produces cerebral spinal fluid, and then I want to note the arrows. Okay, so the arrow of that flow. So looking at the front, looking at how it comes up and around the back. Okay, so kind of a neat one to kind of pause and take a look at for a moment. So go ahead and pause here for a couple moments and come on back when you're done checking that out. Number 2, cerebral spinal fluid flows through the ventricles and into the subarachnoid space via the median and lateral apertures. So there's our median and lateral apertures and their function. So number 2, look below the cerebellum there is what they're referring to there. So again, pause and take a look at this and the flow of the arrows for a moment as well. Number 3, cerebral spinal fluid flows through the subarachnoid space. So number 3, look towards that frontal lobe area. So the kind of bend at the frontal lobe is where number 3 is located. Number 4, cerebral spinal fluid is absorbed into the dural venous sinuses via their arachnoid granulations. So we could see number 1 in the center, 2 underneath the cerebellum, 3 at the frontal lobe area, and then 4 look to the top of the head area. So those arachnoid granulations is what that's referring to, those little bump outs. I like this slide to give you another picture of, so we have our blood flow in the center area, and then the ependymal cells creating this ultrafiltrate with the substances that you see at the bottom right there. So blood, sugar, oxygen, vitamins, all the important stuff, hopefully just the important stuff, and nothing that we don't want is getting through as well. So creating this nice ultrafiltrate of cerebral spinal fluid for us. I have switched over to audio only, so no video, so no need to adjust your screen, nothing wrong, just switching over the format. So let's go ahead and continue. We're looking at the blood-brain barrier. So this barrier is selective but not absolute. So it allows certain nutrients to move by facilitated diffusion. So the idea here is that it is this kind of ultrafiltrate, and hopefully only the good stuff gets in, and the stuff that we don't want our brains exposed to gets filtered out and not allowed up into that cerebral spinal fluid. So metabolic wastes, proteins, toxins, most drugs, small non-essential amino acids, and potassium is going to be denied. It allows any fat-soluble substances to pass, including alcohol, nicotine, and anesthetics. So that's why we feel differently when you drink alcohol, or that's why anesthetics work, and that's also why people like nicotine. It's absent in some areas, such as the vomiting center, or that area postrema is the word for that, area postrema, P-O-S-T-R-E-M-A. So the vomiting center and hypothalamus. So thinking about that, that would be necessary to monitor the chemical composition and temperature of the blood. So that vomiting center needs to know what substances we have going on in our body, and to be able to send a signal to expel it if we've become toxic. So that's why that isn't there at that area. It helps to maintain the stable environment for our brain. So chemical variations could lead to uncontrollable neurons firing. So one of the concepts here when I treat my patients that have MS, or talk to people that have MS, I tell them that something has penetrated the blood-brain barrier that shouldn't. So something is irritating that tissue, and then the immune system is reacting the way that it is designed to. So we need to see what is actually penetrating that blood-brain barrier, and first and foremost, stop that. So first get the defenses up, lock the doors, close the windows, and then try and clean up whatever has occurred. So exceptionally impermeable tight junctions keep the brain separated from many blood-borne substances. Think about if every infection you ever had went straight to the brain, right? If it was just circulating throughout the body and affected our brain, that would not be good. Substances must pass through 3 layers before gaining entry into our neurons. So a continuous endothelium of capillary walls, the thick basal lamina around the capillaries, and the feet of astrocytes surrounding the neurons. So remember our astrocytes, those star cells? Chapter 1 to remind you of the astrocytes. So I just copied and pasted them straight into here just in case you didn't remember them. So this is the picture of the drawing of it, so you can see how it's clinging to the capillary or the blood vessel, and then you can see how it's also clinging to the nerve as well, or the neuron really. The functional aspect is the neuron, and the more structural aspect is this glial cell here, but we know that those lines are actually quite blurred. So in this slide here from your chapter 1, it reminds us that astrocytes are the most abundant, A for A, astrocytes abundant. Versatile, they're highly branched glial cells, or the glue that holds things together. They're clinging to neurons. They're also going to be at the synaptic endings as well, and at capillaries. So they are forming, the feet of these astrocytes are helping to form that blood-brain barrier. So they support and brace neurons, play a role in exchange between capillaries and neurons. They guide migration of young neurons and control chemical environment around the neurons, and respond to nerve impulses and neurotransmitters, which are the chemistry of the cell, those neurotransmitters, and influence neuronal functioning, participate in information processing in the brain. And this was a picture of a scanning electron microscope that I had available for you to see in chapter 1 as well. So those were review slides. This is a new addition to this PowerPoint, and I put a paper in here from Nature. Nature is like the top dog for all PubMed papers. So when something new and exciting and really different comes out, they put it in Nature. So if you get into that paper or publishing, it's kind of a big deal. So astrocytes scar formation aids central nervous system axon regeneration. So what this was telling us in 2016 was that, contrary to the prevailing dogma, astrocyte scar formation aids rather than prevents central nervous system axon regeneration. You can read the rest of the paper there. I left the hyperlink in there for you. It's interesting because we used to think that this scar tissue needed to be eradicated and that this was a problem. And when we see the scar tissue show up, that we wanted to kind of fix it so we could fix the nervous system, where in reality, this is part of the fixing stage. So it kind of changes the way we think about astrocytes and the scar formation. So we were focusing in on our cerebral spinal fluid here, so let's get back into that. So picturing here the vertebra that one day you will be adjusting, right? We could see this as a cervical vertebra. Remember, that's the bifid spinous process telling us that. And then looking at the transverse processes there, you could see those holes or the foramina in the transverse processes. And that is for the vertebral artery, so we know without a doubt that this is a typical cervical vertebra. And you can see where the cerebral spinal fluid is. If you look to the left, that subarachnoid space telling you that the cerebral spinal fluid is surrounding the spinal cord. And then we also have the central canal, which is that hole right in the middle of the spinal cord there. That's going to have cerebral spinal fluid as well. Remembering our anatomy and that the cord proper ends at L1, L2, and anything beyond that is cauda equina, and we're going to have more cerebral spinal fluid in that area and kind of a freer, what looks like more like nerves coming through that area. So think of like a ponytail, cauda equina, horsetail, ponytail. As opposed to a solid mass that we have to worry about when they're doing a lumbar puncture. Not that we do lumbar punctures, but it helps us to remember our anatomy to remember this slide. So what do we do with this information as chiropractors? I like a technique called SOT, or sacral occipital technique, sacrum, occiput, so from top to bottom, or bottom to top here, sacrum coming from the bottom all the way up. In massage therapy, we have a technique called craniosacral therapy. It's pretty much the same thing. So SOT really, in my opinion, focuses on the cerebral spinal fluid flow. Now, in your lab, she's going to tell you that there is no rhyme or reason to the flow, and I disagree with this with the years of work that I've done and studied in these modalities, but that's okay. Everybody has their own opinion on what they do, with the work that they do. So when we look at this, we want to think about that sacrum as a pump, right? So you get the blocks out for that SOT. You'll see it in the clinic. They have a little sticker that says SOT so they can do it. And ask next time you're in the clinic. And so we see these blocks for the SOT technique, and they block the sacroiliac joint, and we kind of do what I call CPR on the sacrum, this kind of bounce, this kind of movement. And what I'm picturing is I'm trying to get the fluid moving in a pulse that I think would be helpful to the body. So getting that cerebral spinal fluid flowing, we see a pump from the brain. Okay, so moving, if you nod your head yes, then basically you're going to start to create a pump there. And then the sacrum also provides a pump. And then just breathing and doing this with breath helps to provide a pump. So things we want to think about here as we're working with the information that we got here and working in these modalities is sacrum stability and mobility. So look at the sacrum here and that SI joint here and the role that iliopsoas here would play. So front and sides of the lumbar spine and T12 and then into the face of the hip. And if one side is tighter than the other, it's going to throw the alignment here off, which in turn indirectly would be then throwing off the alignment of the sacrum as well. So we think about what this would look like if one side is overstretched and one side is contracted. What effect is that going to have on our patient, and what exercises can we give them in order to help facilitate the work that we're doing as chiropractors here? Key point here, looking at that iliopsoas, and then you can see that lateral line down the leg and that anatomy train there of how that's affected as well. But if you look up, you could see the diaphragm. So look at that central tendon and where that attaches into the lumbar spine, and then look at where that iliopsoas is. So if one side is tighter than the other, or both are just tight and pulling unfairly at that lumbar spine, what's that going to do to respiration? So think of upper cross and lower cross syndrome, and what is that going to do for respiration? And it's going to cause issues. And then what is that going to do for our cerebral spinal fluid flow? So that would cause stagnation and issues as well. And then what is a subluxation going to do to this whole complex as well? So we want to keep that in mind when we learn our anatomy here. Here's the pelvic floor, and then the attachments that you could see to the sacrum there as well. So if you look to the left of that picture, you could see piriformis. So that's one of the deep six lateral rotators, if you remember. And that one is going to be that little strap muscle that pulls us out of alignment when the rest of the pelvic floor muscles aren't working appropriately, in my opinion. So what are we going to do about it? How are we going to work with our patients on this? I have my patients do this all the time. It's their basic exercise for mobility of the spine, getting the cerebral spinal fluid flowing appropriately. It's also a great exercise for us just as practitioners, keeping our spines nice and healthy. As a common saying around here and in our business is the most important spine you take care of is your own, right? So what do we do about this? Think about the flow of cerebral spinal fluid as you go into these poses. So cat pose is really just flexion of the spine. Cow pose is extension. So cat, cow, and then the breathing exercise that you do with this. So as you exhale into cat pose. As you inhale into cow pose. And if we get back into school anytime soon, which I think we will, which will be really exciting, you can come to Yoga Club and I will show you exactly how to do these with breathing. And we'll talk about the neurological and cerebrospinal fluid flow connections to these poses. And think about that iliopsoas connection when you're doing this, and think about the diaphragm connection and the fluid flow while you're doing these. So here is an x-ray to demonstrate the wedging that happens when we go into extension and flexion. So this is going to be more extension. So to your left here is going to be anterior, or the front of the body. And then to the back side here is going to be, or to the right is going to be the back side here. So we're looking at a lateral view. And then this is going to be the vertebral body that we're seeing here. And then this, well, I'll draw two of them for you so you could see that. And then what you're seeing in this area here would be where the disc is, that intervertebral disc. So as we go into extension, this back area here is going to close down, and this front area here is going to open up. And then the opposite is going to happen when we go into flexion. So think about what's happening here with the discs and this little massage that they get when we do that cat, cow, child's pose. So that cat being that flexion, the cow being the extension, and then child's pose is designed to be traction. So we're giving this massage to the discs, and then the spinal cord would be back along this side here, because remember we're going to then see spinous processes back out this way here, so it's kind of surrounding that cord. And so what are you going to think about here when we do those flexion extension exercises about the disc and then the flow of the cerebral spinal fluid around that cord? So we're going to kind of stretch things one way and then the other and kind of create a little bit of a pump back and forth is the idea, and then traction. Looking here, we can see this MRI, and I want to point out the cerebral spinal fluid specifically. So this would be the front of the body, this would be the back area, and then again our vertebral body here. Okay. And then the disc is this space in between here, and you can see that it has a differing amount of fluid. So this white fluid here is cerebral spinal fluid. So the darker it is, the less fluid in that space is basically how we're going to look at it for right now. You'll learn more from Dr. Che on how to read an MRI, but the basics right here. And this little guy right here is kind of interesting. So see this little white space here? I'll switch to a red pen so you can see where I'm drawing better. So see that little white space there? I'm going to erase it so now you can see it. That is the equivalent of the fluid moving so much so that if you were to wave on camera and then take a picture of it, you'd see a blurred hand. Your hand isn't actually blurred, but it's moving so fast that the camera doesn't pick it up appropriately. So what we see there is fluid movement to the point where we just see this kind of blur. So that's not a break in the bone. That's not necessarily anything pathological. I mean, it could be, but it's not necessarily, because that is just the fluid moving through the bone at a higher rate. So kind of a neat thing right there, I think, when we see those. So looking here, you want to be able to see that white area here being the cerebral spinal fluid. Okay, and how much space that really does take up. And then the darker aspect here would be the more solid parts of the cord and cauda equina coming through. Okay, so it gives you a little bit more perspective. And then another picture here to give you perspective. So the image on the left is a T1 MRI and the image on the right is a T2. So if you note, it just shows the fluid as like the opposite color basically. So the T2 weighted image, the cerebral spinal fluid is in white, and then the T1 image, the cerebral spinal fluid is in black. So that's our, Dr. Che will explain more of the difference of that to you, because he's an expert at that, but for our intents and purposes, that's what we're looking at here as well. And then what I want to cover here is the idea of what do these herniated discs over on the right upper area with the arrows here, what are those herniated discs going to do to the flow of cerebral spinal fluid? So not only thinking about it neurologically, right, but what's going on here with our proper fluid flow. So the idea that a lumbar herniated disc can affect your brain is pretty obvious when you actually know the structure and can see that this is one unit here, one contained unit of that cerebral spinal fluid, same fluid flowing at the brain and flowing all the way down through the cord. So it's like the equivalent would be like if you put a syringe of some sort of medication into the vein at the arm, the rest of the body is going to feel it because it's a closed system of fluid. So we want to look at this lumbar spine and herniated discs as something that would also affect the brain and cerebral spinal fluid flow there as well. So look off to the left here, the one without the arrows. The arrows are quite obvious over there, but we could see this vertebral body here. See the fluid flow in and out of that bone area there, kind of neat looking. And then what happened here, right? This whole area here appears to be from this disc. Again, I went a little outside the line there. Okay, so look at this guy here. What happened there? And then that's encroaching in on this cord area, or cauda equina if we want to be more specific, area here. So you could see that this dark spot, I'll erase this so you could see things a little bit better. So you could see that that dark spot is the disc, kind of protruding out a lot through here, but this dark area here, these little lines here, are going to be cauda equina, and then the white is going to be the fluid. So again, this really brings it home for us to be able to see what's going on here with a herniated disc and subluxation and misalignment, and how that's going to affect all aspects of our nervous system and our brain, including. And then look at this bottom picture here. You could see this sacrum here, right? Oh my goodness. You want to just push that way, don't you? Right? So we would just put them on the blocks and start to pump that sacrum in this kind of coupled direction, right? So kind of get that back in alignment. And then what happened through here, right? So we could see the cord, this darker area here, and then it just kind of gets a mess. I'll erase some of these lines so you can see it. So it just kind of gets really messy right into this area here. Okay. So really bringing into a clinical perspective the anatomy here of what we would do for our patients and how this would help, right? So look up at the left, upper left picture of this sacrum here as well. You'd really want to just bring it that way as well too, right? So you can just see where you'd rather it be down here. Same thing here, right? So we see this theme of these sacrums kind of sticking out here, right? Probably from sitting all day, bad posture. So I'd want to see this a little bit this way instead. So again, you just put them on the blocks, start to pump the sacrum down, and give them better alignment exercises, cat-cow child's pose, and pelvic floor exercises, as we saw how that's the basis for these structures as well. So go back and look at those slides if you need to kind of see that again, but it tells the story of how to try and fix this and what's going on. This is really cool, you guys. So take some time, pause this, hang out with this YouTube video. What it's showing here, if you look at the bottom, the words at the bottom, cerebral spinal fluid flow before a specific upper cervical adjustment and cerebral spinal fluid flow after, and then note where those arrows are. So normally I play this in class, but you guys just pause, take a look at this here, and look at where those arrows are and where it's not flowing appropriately, and then after their upper cervical adjustment, how it's flowing after that. So this website's pretty cool, I think. So you hopefully paused and took a look at that video. If you didn't, again, check it out. It's pretty much what we do as chiropractors, so it's should be interesting to someone studying chiropractic. I really hope. So here we go with this 13 millimeter tonsillar and brainstem descent here, or what we might call a cerebellar tonsillar ectopia, or CTE, not the football CTE, but cerebellar tonsillar ectopia, also known as an Arnold-Chiari malformation. We'll get into that when we talk about the cerebellum, but what I wanted to show you here was this line right here, okay, to here. So this space, let me change colors here. I'll go for green. This space here would be the foramen magnum. Now I want this structure here to be above this line here, and it's not. So one of the things we want to think of here with this lesson, before we go too far into Arnold-Chiari, CTE, looking at the cerebellum and all of those different things in different lessons, which we will get to and see this again, but think about the cerebral spinal fluid flow. So it is congested through here. It's like a clog in the drain right there. Right, so we're not able to get the fluid flowing down and up appropriately because this guy right here, part of the cerebellum, which is this guy right here, has herniated down through that foramen magnum. So that is not a good idea. So we want to do some specific upper cervical work. The way that I would do it would be through cranial sacral therapy or SOT, and get some, hopefully get some good results through that. I've seen it before in the past. I've worked on it before in the past and got them to where the surgeon no longer thought they were a surgical candidate. So it can be done. We can work on that. But the idea here is to show you the anatomy and then start to think about what that cerebral spinal fluid flow would look like in different structural anomalies here or injuries. Just another picture here of the cerebral spinal fluid. You could see it in the lateral ventricles here. These are just the lateral ventricles. Just a cool picture looking here. So you'd be looking down, right? Or up. I'm not quite sure what view they're looking at here. So this is a horizontal or transverse slice. So imagine looking down So another one with the normal flow on the left and then the lack of flow. So what we're looking at here are these white lines here for fluid, remember? Nice fluid flow here. And then we can even see it in the front area here. So this is the face. You can see their face right here, that nose area, right? So then what's going on here? We've lost a lot of fluid flow right there. I'll erase it so you can see it again, compare it side to side now that we know where we're looking. Okay, so how would you work on that? I would work on their sacrum. I would work on their upper cervical, super gentle. I'm not going in there and doing a big old rotary brake, high velocity, low amplitude HVLA crunch on this person. No way. Somebody else might, but that's not what I would do. And I would go nice and gentle and start to reestablish that flow of fluid again. The movement artifact here is all that this one is pointing out. I thought this was kind of a neat looking picture, so to show you that, they're showing that little line there as movement. So remember the idea of waving the hand and then seeing the hand as blurry? That's what they mean. Okay, back to the book here. So some terms we want to know. Hydrocephalus. So your grandparents would probably call this a waterhead baby. Water hydrocephal head. Okay, so hydrocephalus, waterhead baby. I didn't make that up. Ask your grandparents or anybody over the age of 70 or 60. It's an obstruction blocking cerebrospinal fluid circulation or drainage, resulting in increased pressure. We see it in newborns. Their skull bones are unfused, so increased pressure causes the head to enlarge. In adults, this rigidity of the skull keeps the pressure within, potentially leading to brain damage. It can compress blood vessels and crush soft nervous tissue, and treatment is to drain the cerebrospinal fluid with a shunt into the abdominal cavity. And this would be an extreme example for you to try and remember what hydrocephalus would look like in a newborn. And they would shunt this cerebrospinal fluid out of the body first and then put in a shunt draining into the abdomen and then monitor this baby after that. And there you go. That is our cerebrospinal fluid and ventricles lesson. So hopefully you're able to kind of pick up on a couple of clinical applications for this lesson as well. So as always, email me, text me, get a hold of me with any questions, comments, concerns, or just say hi. It's fine by me as well. And I'll see you for the next lesson.